Hello, this is Jonathan Kay from the University of Massachusetts Medical School reporting for Room Now at EULAR 2021. On this first day of the meeting, there were three very interesting epidemiologic abstracts presented in the opening plenary session, all dealing with rheumatoid arthritis. Cigarette smoking has been shown to be an important risk factor for the development of rheumatoid arthritis, especially with anti-citrulline protein antibodies, and particularly in individuals who carry the HLA-DRB1 shared epitope alleles. But what about passive exposure to cigarette smoke? Well, abstract OP0012 by Nguyen et al. Found that passive exposure to cigarette smoke, especially during childhood, increases the risk of developing rheumatoid arthritis by nearly 50% among women who never smoked. However, passive exposure to cigarette smoke did not increase the risk of developing rheumatoid arthritis among women who had previously smoked themselves. This large population-based prospective cohort study of nearly 80,000 French women suggests that inhalation of byproducts of cigarette smoke generates autoimmunity towards antigens involved in the pathogenesis of rheumatoid arthritis. Interstitial lung disease as a complication of rheumatoid arthritis has recently been a topic of great interest to rheumatologists. The RS3570590 variant of the MUC5B promoter has been identified as the strongest known genetic risk factor for developing interstitial lung disease in patients with rheumatoid arthritis. What impact does this promoter variant have on the long-term incidence of rheumatoid arthritis-associated interstitial lung disease? Well, Palamaki et al. In abstract 0P0007 found that the presence of this variant in patients with rheumatoid arthritis conferred a lifetime risk of nearly 15% of developing interstitial lung disease compared to only a 4% lifetime risk in individuals without rheumatoid arthritis. It remains to be seen whether this finding can be applied clinically to identify individuals at higher risk for developing interstitial lung disease and to intervene therapeutically. In clinical practice, the question always arises as to whether biological or targeted synthetic disease-modifying antirheumatic drugs increase the risk of developing COVID-19 or increase the potential severity of COVID-19 infection. In abstract OP0006, Sparks et al. Analyzed data from the COVID-19 Global Rheumatology Alliance. Of the nearly 1,700 patients with rheumatoid arthritis treated with biological DMARDs and targeted synthetic DMARDs at the onset of COVID-19, those treated with rituximab had a 6-fold greater risk of dying than those treated with TNF inhibitors. Those treated with JAK inhibitors had a 1.5-fold greater risk of death. This underscores the importance of risk mitigation strategies such as vaccination, social distancing, mask wearing, and good personal hygiene, especially among rheumatoid arthritis patients receiving rituximab or JAK inhibitors. Well, tomorrow is the second day of EULAR, and there will be more abstracts about rheumatoid arthritis and other diseases presented, and I'll be back tomorrow. But for more EULAR 2021 coverage, head to roomnow.com. I'm Jonathan Kay.